Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. Going to the doctor is difficult even under the best of circumstances. Hospitals and medical offices have struggled with staffing shortages and increasing patient needs. The staff of Family Practice Associates has some tips on how to make your visit easier. These tips are specific for Family Practice Associates, but they can be used for any doctor's office visit. We went out to Family Practice, and here's what they told us. It all starts with a telephone call. Gina's been answering the phone at Family Practice Associates for 38 years. So tell us how to make it easier with that first phone access.
When you first call in, listen to the options that you're given. There's several to choose from. It's going to tell you to press option 1 if you want to schedule an appointment, or option 2 if you have a question. There are several others that I'm not sure on the numbers with those, but yeah, just listen to your options. Once you get through to us, if you have a need to make an appointment, then we're going to work with you to get that to work with your schedule, and then you'll want to have your insurance card handy, because after we schedule the appointment, we'll put you through the business office. We'll get your insurance information and make sure we have that on file. If you're needing something like a refill, then it would be really good to have your bottles in hand so that you can tell us the names of the medications, because we won't know by color or shape or anything like that. So make sure you have the names of the meds. You can also do online scheduling for appointments. You can do that yourself if you don't want to hold or wait on the phone at all. And then you can send us messages in the computer through your portal account that you're going to set up. And you can ask us anything on the portal for refills, for appointments, for questions that you have, anything like that. I think that's it.
Is there a better time to call than another better time or better day?
Absolutely. If you need an appointment, it's best to call first thing in the morning, especially if you need one for that day. Call as early as you can. If you need something like a refill, I would wait and call a little bit later. The call volumes are the most heavy between like 8 to 10 in the morning, so I would call after that time for other things that you don't need right away, and you won't have nearly as long of a hold time.
Is there an option to have somebody call you back if you don't want to wait?
Oh, absolutely, yes. If it says that you're the 5th caller in queue, then you have the option to press a button that will have us call you back, and we will call you back. It's automated. It dials it for us. So once we are free, whoever's on the phone hangs up, your number will ring through to us next, and we'll call you back and see what you need.
After the phone call, the next process is check-in when you get to Family Practice. Kara's our front office manager to give you some tips on how it might be easier.
All right, so after you schedule your appointment, about 3 days before, you'll get a text message and an email that'll let you confirm your appointment and automatically do the pre-registration. The pre-registration is done by new and established patients at every visit. Once you complete that registration and you arrive at the office, you'll get a message that says to let us know when you've arrived, and then another message to tell you to come into the office. Once you do that, you come to the front desk, hand them your most up-to-date insurance card and photo ID. We require having those scanned in every year. And then if you haven't done the pre-registration, we'll have you do that in office while you're here, either on your phone or on the tablet. And after you've completed that, you'll wait in the lobby until an exam room's ready.
After the check-in, the next part is a visit to the exam room. This is Amanda, our clinical manager, to give you some tips to make it easier.
We're usually going to start by calling you back from the waiting room, and then the CMA will take your height and weight, so be prepared for that. I know that's always not fun for most people, but that's something that we have to do to ensure that we get the right medication dosages and ensure that we can treat you properly and correctly. Then we'll take you back to the exam room, and some of the things that you can do to be prepared for your visit are prioritizing your diagnoses and your medical problems. Always focus on the ones that are most pressing at the beginning, and then if you have time, we can get into everything else. And if not, we can always make a second visit for you to come back for that. Another thing is to always be fasting if you're going to be due for fasting blood work, so we can get that blood work while you're here in the office, so you don't have to make a separate trip back in to have that done. Along with be prepared to leave a urine sample. So always wait to go to the bathroom before you get here just to make sure that we're not going to need that urine sample from you.
After the visit, you may receive a referral to a specialist for a diagnostic test. Shannon's here to tell how her referral team might be able to help you.
So after your doctor puts in a referral to see a specialist or to have a procedure done like an MRI or CAT scan, our referral team will take that order and send it to that specialist or diagnostic facility. That facility will contact you within 24 to 48 hours mostly. To find out your test results, make sure that you're checking Follow My Health portal. The providers communicate with you about your test results through your Follow My Health portal. If you've not heard back from your lab tests that you've had done or your x-rays, send a message through your web portal to your provider to check on those, or call the office or send an email to askfpa.com.
All right, we went out to family practice to talk to Hunter in medical information. And once the visit is done, sometimes people need some forms or medical records. Is there something they can do to make that an easy process?
Sure. If they need any medical records, they can always give us a call here, 859-278-5007. They can speak to one of us about what they need, or they can email those to askfpa@fpalex.com. And then, of course, they can always fax those as well, 859-278-6867, or you can email those requests. Generally, we do need a release of information signed, but we can discuss that with you. If there are any forms or anything, again, if you didn't drop that off during your visit, you can either email that to us or fax that to us as well.
How long of a time should you expect for turnaround?
Turnaround for forms, we have 10 business days. We do those in the order that we receive them, so if you need those quickly, you need to make sure that you get those in as quickly as possible. For medical records, we do have 30 days, but again, we do those in the order that we receive them, and it generally doesn't take that long, but the quicker that you do that, the faster you get them back.